Welcome everybody to the Mind Body Balance webinar for today. We have an excellent panel of speakers for you. First, want to thank Mary Angela from Center on the Hill to help kind of coordinate and put this all together. Really wanted to give a brief overview for those that are not familiar with New Courtland. Before we get started, New Courtland is a mission-based nonprofit organization of affordable housing for seniors. We also own 3 senior centers here in Philadelphia. We provide health and social support services through our Services on Site program, where we utilize our social workers to help coordinate community-based services for our seniors. On our Germantown campus, we also provide housing for homeless and near homeless veterans, and then help coordinate those health and supportive services so that they're able to reintegrate back into the community. And we have a fabulous nursing home, Germantown Home, which is a 180-bed nursing home that provides long-term, short-term skilled rehab and respite services for those caregivers that are looking for a break. Just by the numbers, New Courtland serves about 8,000 seniors. We are committed to serving those seniors in Philadelphia, primarily in North, Northwest, and Northeast Philadelphia. And this just shows you, a breakdown of, the number of lives that we help. New Courtland, like I said, is very highly committed to serving the Philadelphia population and really growing in the need of housing and health and social support services. I just want to touch base a little bit about Germantown Home. What makes Germantown Home really unique is that it is part of this larger mission-based organization of housing and services. It's a very vibrant community where we have innovative programming. We have 11 full-time therapy staff there, a full-time nurse practitioner and medical director, with extensive geriatric knowledge. And we have a secure memory unit on our 4th floor for those with Alzheimer's and dementia. So, really committed. The staff, many of them have been there a long time. I'm the liaison with the hospitals for those that do get referred to Germantown Home. But really, New Courtland is a wonderful organization, really providing those services so that seniors could age in place. But then if they cannot, really considering Germantown Home as an option for them for the long term. So today, I want to introduce our first speaker, Dr. Jeffrey VAKIL. He is a board certified orthopedic surgeon with Premier Orthopedics, who evaluates and treats adults with hip and knee disorders. He's the first orthopedic surgeon that will be serving patients at Chestnut Hill Hospital. Thank you, Dr. VAKIL, for your time today. We really look forward. Our second speaker will be Melissa Smith, who is from AgeWell Physical Therapy. She's a doctor of physical therapy, a geriatric clinical specialist, certified exercise expert for aging adults, and she will be talking about practical applications of exercising the mind and body, and also is a Tai Chi expert. And then last but not least, one of my close friends, NATASHA GOLDSTEIN-LEVITAS, who is a board certified dance and movement therapist, aging and dementia advisor, and also a published author. So she's going to be doing a lot of different movement. So we'll have an educational component and then fun kind of movement balance. So, it incorporates that all together. As we know, right now we're home. A lot of us are home. A lot of us, need some tips and tools in order to keep the body moving. So this will be our panel of speakers today. So we'll move it over to Dr. VAKIL.
All right. Thank you guys for having me. I appreciate getting all this together. This is great. And I'm looking forward to helping people understand a little bit more about, hip and knee problems. Typically, arthritis is really my ball game that I deal with, and so I'm really going to kind of focus on that. So let me share my slides here, and this is Let's see if we can get this going. There we go. So again, as Allison had said, I'm one of the premier orthopedic surgeons here. First premier orthopedic surgeon here at Chestnut Hill. So I do hip and knee replacement here. We do anterior hip replacement and minimally invasive hip and knee replacement. And we've had some great successes here at Chestnut Hill. I do have a couple partners here who do help me with some general orthopedics, sports, shoulder. So we do really cover and hand, and we do cover a variety of different orthopedic problems. So please feel free to always contact us. We're always here to help from any perspective. So again, I'm going to talk about hip and knee arthritis and your treatment options. Just some numbers here. Joint replacements are becoming a lot more prevalent amongst our communities, and we're projected to increase the number of joint replacements tremendously over the upcoming years as our population ages more and people are more expecting of having a nice life without pain. And so certainly joint replacement really being the final option for osteoarthritis of the hip or knee is going to become more and more common as our patients' age population increases and people are aging more in a healthy fashion. So again, more numbers of showing how many primary total joint replacements we're going to be doing. Well, with primary joint replacement, which is actually the first joint replacement we do, meaning the first total hip or knee replacement we do, those do wear out after about 15 to 20 years. So we will be performing, we do have to re-replace some of the ones that wear out, and those numbers will be increasing also. Unfortunately, arthritis and pain in the hip and knee costs a lot of money and a lot of restricted days of activities. So there's a lot of money going into the lost wages and medical care, but also certainly restricted activities of patients. Well, let's talk about knees first, and we're going to kind of talk about the anatomy and also what can go wrong and what you can do about it. The knee joint is made up of muscles, tendons, bones, ligaments, and cartilage, and then it's a pretty complex structure. People think it's only a hinge joint, but it really consists of many muscles, many muscles, tendons, ligaments, and certainly the bony structures are relatively simple. There's only 3 really that participate in the knee joint, but certainly the surrounding muscles and tissue help to participate in its function. So really the knee joint itself is made up of the thigh bone called the femur, shin bone called the tibia. I'm going to use my pointer here, tibia, femur, and then the kneecap called the patella. And then there's the small bone called the fibula on the outside. And the fibula really doesn't contribute much to the function of the knee, but it does have attachment to some of the supporting structures that do help stabilize the knee joint. There are some ligamentous structures both on the inside of the knee, which is called the medial collateral ligament, and then there's the lateral collateral ligament, and then there's 2 strong ligaments on the inside of the knee. All of these function in stabilizing the joint. But also there's other cartilaginous structures or cartilage structures called meniscus. And these help pad the ends of the bone and give support to the joint itself. But when we talk about arthritis, we're not really talking about the ligaments, but we are describing meniscus, both the lateral and medial. So there are 2 types of cartilage. Like I said, the meniscal cartilage, and then there's the articular cartilage. The names are not as important as their function, but basically the articular cartilage is the cartilage that's adherent directly to the end of the bone, both on the femur and on the tibia. And actually we don't show this here, but there's the thickest cartilage in the body is underneath the kneecap. But basically that's a padding that allows the bones to move smoothly upon one another. Over time, that cartilage, the articular cartilage, can wear away. And when that cartilage wears away, that also can lead to damage of the meniscus, which is related to arthritis. So basically, arthritis is simply the wearing away of this articular cartilage and meniscal cartilage. And ultimately, if this cartilage or protective padding wears away to the point where the underlying bone touches the underlying bone, that's called bone-on-bone arthritis or severe arthritis. And there's multiple levels in between. No arthritis, mild arthritis, moderate arthritis, and again, bone-on-bone, which is severe arthritis. Certainly, again, another picture of the meniscal meniscus from the kind of top view, looking down on the lower leg bone, the shin bone. And menisci can tear. In the acute injury in the younger athlete, meniscal tears can require surgery. But as we get a little older, and if the meniscus tears due to the arthritis, that's not really something we would operate on. Really, what we're going to be treating is the underlying arthritis and not just focusing on the meniscal tear, because that's not the only thing that's damaged in arthritis. Here's another picture of the articular cartilage. I think it's best to look at, to figure out what I'm talking about is if you look at the end of a chicken bone and you see that white cartilage on the ends, that's the exact type of cartilage. Obviously, the chicken bone is smaller, but that's the exact type of padding or cartilage that's present on the ends of our bones and all of our joints. And ultimately, that's the cartilage that wears away that we call arthritis. So when you do develop knee pain, what do? What's wrong, and what should you do about it? Well, you come to see one of us for an evaluation. That evaluation always starts out with a history. We want to know when the pain started, how long the pain has been present, when does the pain occur, what limitations do you have, and where the pain is. We love to do a physical examination, touch, feel all the joints, move the joints around, seeing where the exact pain is coming from, and that helps us localize and focus our attention. To the x-rays. We love to get x-rays. X-rays are the first diagnostic study that we obtain. Simple x-ray really gives us a lot of information. A lot of people want to come in, let's get an MRI, but certainly an x-ray that may cost only $100 can give you a lot of information, and in fact, much more information about the bone structure and the actual amount of cartilage, more so than an MRI. So in the patient population above 50, we love to get x-rays first, especially if it was a slow onset in pain, because that doesn't really indicate an acute injury. If there's an acute injury, I fell, my x-rays are normal, well, certainly we can consider an MRI, because that's looking more closely at the soft tissue structures around the joint. But really, x-rays, standing x-rays, multiple views are really what we rely on the most. If those x-rays are normal, then we may get an occasional MRI to help us figure out what else is going on if those x-rays are normal. So what is arthritis? Like I said before, it's simply the wearing away of the cartilage at the ends of the bone. Not only that articular cartilage wears out, but also the meniscal cartilage. So I'll have patients come in with x-rays that like this that show no space between the ends of the bone. Here's a normal x-ray. A normal x-ray, that space between the ends of the bone really represents both the articular cartilage and the meniscal cartilage. So when we look at x-rays, when that joint space starts to narrow and we get some other changes in that joint, but when that space narrows, we know that this process is going on. The articular cartilage is wearing and the meniscal cartilage is worn as well. So oftentimes people say, well, I have arthritis, but is my meniscus torn as well? Because maybe we should focus on that. I tell them, yes, your meniscus is definitely torn, because that's arthritis. It's the wearing of the entire joint and all the structures, surrounding structures that pad the ends of the bone, those two types of cartilaginous structures. So undoubtedly on this x-ray, the meniscus is no question about it torn, but certainly the bone, the cartilage has worn down where its bone is rubbing against the bone. Well, what happens? Well, that wearing away of bone causes inflammation and pain and limitations of activity. Stiffness, weakness, knee gives out, pain, can't walk distances, steps are painful, pain at night. So this is typical of arthritis, and it waxes and wanes, but unfortunately it's a chronic degenerative condition that continues to worsen over time. Why did I get arthritis? Well, there's a bunch of different reasons. We don't know the exact reason. There's no way to point a finger at one reason versus another, but certainly over time, cartilage can wear out. Weight certainly plays a big role in it. If you're a little on the heavier side, certainly that puts more pressure on the joints and can wear out your cartilage faster. And genetics. My mom, my dad had arthritis. They had joint replacements. Well, that may predispose you to having degeneration of your joint as well. And certainly if you played a lot of sports, you had an injury, you may have had a meniscal tear in the past where that required surgery as a youth. That certainly can predispose you to the wearing of that cartilage. So what do? Well, we start with the most conservative measures first. And basically there's a simple algorithm. We start with, hey, go buy a bottle of Tylenol, Aleve, or Advil. Aleve and Advil are anti-inflammatories. They're over the counter. We also have prescription brand anti-inflammatories, but arthritis is an inflammatory problem. When the bone or the worn cartilage starts to wear, starts to rub against each other, it causes inflammation and pain. So really the cornerstone of management is anti-inflammatories. Some people can't take them due to medical issues or being on blood thinners, but ultimately anti-inflammatories in short courses, but consistent, whether it's 2 straight weeks or 3 straight weeks, are very important in helping to decrease that inflammation over time. There are also, again, prescription brand anti-inflammatories. And then for those folks who can't take anti-inflammatories, Tylenol is a nice alternative as well. So then we get to other activities, other modification of activities. So, hey, doc, my arthritis is getting worse. I can't walk 10 miles. Well, modify those activities and walk 4 miles or 2 miles. Or you got to maybe modify those things you do in the gym, because if it hurts a lot, it might not be the best thing to do to continue those. So rest and modify your activities. We talked about the medications, the anti-inflammatories and Tylenol. And then once the pain starts to get better, and hopefully it just gets better with that, you can then return to the function of low impact exercises such as swimming, treadmill, biking, elliptical. I would not, if you have arthritis, really run or jog. I think that's really wears the joint out faster and can really lead to more pain. Physical therapy. People look at me funny. Why would I do physical therapy if my knee is hurting me? Well, anytime you have pain around any joint, the muscles around those joints become weak. And so therapy helps to strengthen those muscles and help stabilize the joint. Unfortunately, none of our conservative measures are available to grow the cartilage back or fill in the gaps that the cartilage has worn. It is a chronic degenerative condition, and these conservative options are really temporary solutions to the underlying problem. We always recommend weight loss. In certain cases, losing a pound of weight can be worth 3 pounds of weight off of the knee joint. So that's important. If you lose 10 pounds, it can be worth 30 pounds of pressure off of the knee joint itself. Then we get a little bit more aggressive. Talk about bracing, getting a neoprene sleeve or ordering a brace in from our office here. We can use canes and walkers. And then joint injections. What are those joint injections? Well, there's 2 types. There's cortisone, and then there's joint lubricants. The cortisone is a local, powerful anti-inflammatory that is directly injected into joints that are arthritic and help decrease that inflammation and help with pain. Cortisone doesn't work right away, but can help with that inflammation over a time period. And it's typically about 5 to 7 days that it takes the cortisone to really take effect. And then there's cortisone injections can be given every 3 months if necessary. I wouldn't just get them just to get them, but if you need them, they're available. Typically, most safely done every 3 months. Now, joint lubricants. Some people feel as though, hey, these joint lubricants grow my cartilage back or pad the ends of the bone. Unfortunately, they do not do that, but they are made of joint fluid components that may lubricate the joint temporarily, but they don't know exactly how they work, but really work best probably in mild to moderate arthritis. When it's bone on bone, not a whole lot really works for long periods of time, but certainly all of these things are an option and on the table. Well, to put a picture of chicken, because the Synvisc is actually made from chicken combs, the other medications are made in a laboratory, but again, that's famously Synvisc is made of chicken combs. So now what's next? Hey, none of these things are working, Dr. VAKIL. I can't take it anymore. We saw my x-rays. I had bone-on-bone arthritis in my knee or hip, and we've tried all of these things. It's killing me. Well, what is next? Well, total knee replacement. In this part of the lecture, but certainly in my hip lecture would be total hip replacement. So unfortunately, the final option is total joint replacement surgery, but I can tell you joint replacements work great. And they work very well for years and years. We typically tell you about 15 to 20 years they last, but the implant materials we're using now are starting to last longer. So what about knee replacement? There is partial knee replacement and total knee replacement. Why? And certainly minimally invasive surgery. Certainly, I'm going to touch upon what those two the two knee replacement surgeries are all about. But certainly, we like to talk about minimally invasive surgery. What does that mean? Well, minimally invasive surgery truly means that we're only making smaller incisions, and those smaller incisions take less time to heal. Those smaller incisions are easier on the patient. They heal faster and can recover quicker. So there are some ads out there from other practices. Do you cut the tendon? Do you not cut the tendon? No particular ways to do a total knee replacement. And these are the types of ways to get into the knee joint, whether it's into the tendon or into the muscle or under the muscle. Unfortunately, none of these are better than the other. If there was one that was better, we'd all be using them. But certainly cutting into the tendon versus not cutting into the tendon really is the same outcomes. No research has shown one is better than the other. It's really surgeon preference, but we use the same implants. We've developed new instruments to get those implants in, but we do use small skin incisions, which again allow the patient to recover quicker. So we've done thousands of procedures. I've done 1,000 hips, 1,000 knees, and we're still really truly trying to find that minimally invasive procedure, because unfortunately we still have to replace the ends of the bone that are worn out. But again, with smaller incisions, we do have happier patients. So what do we do? What are these surgical options? Well, here are some early stage sports injuries that we may consider arthroscopy. And that consists of the younger patient with the acute meniscal tear or tendon or ligament tear that occurs during sporting events. We can then use an arthroscope to go in there and clean up the joint. Well, if there's any arthritis in the joint, doing a scope is not going to help the underlying problem. That's actually going to make it worse. That underlying problem can worsen with a scope. So typically we do the conservative measures, and then obviously we may move to a partial knee replacement or total knee replacement. Well, what's a partial knee replacement? Well, only one part of the arthritic joint is replaced. It's similar to a total knee replacement, but and where we replace that part of the knee with metal and plastic. And it's definitely a shorter recovery time because we leave all of the ligaments intact and only replace one part of the joint. Unfortunately for that patients, this is only about 5 out of every 100 patients that we see, or 5% of the patients. It's only when the x-rays show one arthritic part of the knee joint, then we can replace that one area. Unfortunately, most people do have arthritis in more than one areas, and then that would require us to do a total knee replacement, meaning replace all the parts of the joint as opposed to a single part of the joint. If you had arthritis in more than one area of the knee, if I only replaced one part of it, you'd be unhappy because you'd still have pain because you'd have arthritis in other parts of the joint. So unicompartmental or doing a partial knee replacement, recovery in weeks to not months. You go home the same day. People like it, high improved satisfaction. Unfortunately, they only last about 10 to 15 years. And then typically another part of the knee wears out, and then you have to have a total knee replacement, and it makes it a little more complex. So again, just about 5% of the patients are really a candidate for this. So this is a picture of severe arthritis where all of the joint is arthritic. This is a normal joint on the other side, nice spaces. This is a knee that needs a knee replacement, certainly if all the conservative measures have failed. It's the gold standard for advanced osteoarthritis. Great long-term survivorship, meaning they last 90% of the time, about 15 to 20 years. So 9 out of 10 of these total knee replacements last 15 to 20 years, and it's one of the most successful procedures in orthopedic surgery. Well, what do? Well, we open up the joint, we trim off the ends of the bone, and we replace it with these metal implants, whether it's wedged onto the bone and the bone grows into it, or we cement them onto the ends of the bone if the bone is not that great. but certainly we replace all the worn out ends, getting rid of all the arthritis and replacing it with what this looks like. This is a total knee replacement by X-ray. So that's knee replacement and really treatment of arthritis from the beginning to the end. And this is a total knee replacement. Now let's quickly talk about the hip joint. I want to make sure I leave enough time for my colleagues. So bottom line is the hip is a different type of joint. The hip joint is made up now of the upper portion of the thigh bone called the femur. It angles off no neck and ends in a ball. That ball sits in a socket. There's cartilage on the end of the ball, cartilage on the inside of the socket. The labrum is a lip of tissue that makes the socket a little bit deeper. And then the socket itself is located in the pelvis. So when we talk about arthritis, similarly, when we talk about the knee, it's the wearing of the cartilage at the ends of the bone. It looks something like this. A normal hip should have a nice round ball with a space between that ball and the socket, that space representing normal cartilage. As the cartilage wears away, that results in what this appearance of bone rubbing against the bone with cysts and spurs and bone on bone and whitening of the bone, all of the signs of severe arthritis. Like a knee, it causes stiffness, loss of motion, loss of strength, pain, deconditioning, and muscle atrophy. And again, similarly, the algorithm of treating the hip arthritis is over-the-counter medications, Aleve, Advil, Tylenol, rest, activity modification, physical therapy, weight loss, and you can also consider injections. The only type of injection we typically use in knee and hip arthritis are cortisone injections. The gel injections are not really approved for hips, but sometimes people do get them. But again, cortisone is really researched, and cortisone can work, especially in mild, moderate, and sometimes severe arthritis. But again, remember, these arthritic conditions are chronic degenerative conditions that worsen over time. And then we can also consider a cane or walker. So then ultimately, if those conservative measures don't work for advanced degeneration of the hip joint, total hip replacement surgery. And in some cases, and in most cases, are really easier than a knee replacement. The hard part about knee replacements are doing the exercise and therapy afterwards. The knee replacement requires a lot of really motivation by the patient to really get that knee moving. The knee can get stiff after surgery, and you have about 8 weeks to 3 months to really get that knee moving afterwards. But the hip itself, really, after hip replacements, we really don't send people to therapy afterwards. I have them do the therapy on their own, and really the therapy is just walking with a walker initially, transitioning to a cane, and then nothing, and after that. But bottom line is, not a whole lot of therapy needed. You just need to walk with a hip replacement. So the conventional joint replacements that we used to do, big incisions, painful, long rehabilitation, a lot of blood loss, but they were successful. These were the implants we used to utilize. We have modified those tremendously, and we have some great implants that last a very, very long time. The conventional total hip replacement was a large incision over the side of the hip, and we used to come from the back, but we've changed our approaches also, but we didn't have to make big incisions. We realized we could make smaller incisions, and we were doing those total hip replacements through these mini incisions, and that started around 2001. So then there are a couple different surgical approaches for these mini incisions. They all work very well. I personally like the direct anterior approach. I've done 1,000 of them. It's a 9-centimeter incision, or 3.5 inches. We split between natural muscle planes. We remove none of the stabilizing muscles and tendons that are removed after posterior hip replacement or direct lateral hip replacement. And there are other approaches that utilize other ways to get into the hip joint. But these three, posterior, lateral, and direct anterior, are really the main ways that people get into the surgeons get into the hip joints and replace the hip joint. They all, in the end, work very, very well. There are restrictions after posterior hip replacement. This is the anatomy of the back of the hip, where we have to remove these tendons to get into the hip joint from the posterior approach, and then these tendons are repaired afterwards right to the bone. There are limitations. We have you use a pillow while in bed. We do have limitations in range of motion. You can't bend your leg past 90 degrees, turn it in or cross it over. We don't like you to bend over after an after a posterior hip replacement, because they can, I thought I had a picture of it, but unfortunately posterior hip replacements have a slightly higher risk of dislocation. So when those tendons do heal, you can increase your range of motion, but there's always a slight increased risk of posterior dislocation because we have violated the tendons in the back. There is the lateral approach, where we remove this tendon on the side of the bone. We go in still from the front, so we don't really have the restrictions and the pillow between your legs, but any hip replacement can dislocate. The problem with the lateral hip replacement, there's always a potential for limp, and that's called a Trendelenburg gait, because when we repair that tendon back, there can be some muscular dysfunction or weakness that can cause a limp. So why would anybody want an anterior hip replacement? Well, the reason why I would want one is because I've done 1,000 of them, and I, in fact, have had one myself. I didn't do it myself, but I had a successful anterior hip replacement, and everything, all the 1,000 that I've done is exactly what I had expected after mine, and I really am very pleased with it, and it was a very quick recovery. What does that mean? Well, we come from the front, so anterior means I make an incision on the front of the thigh. It's typically between these two muscles here. We split, I make an incision about, again, 3.5 inches over this muscle, and I split between these two muscles, and the hip joint is right underneath that. We have a modified operating room table. This is called the HANA table. We use a single incision. I do use real-time x-ray during that surgery, so I can make sure the implants are well-sized, appropriately sized for you, positioned well, and then make sure your limb lengths are equal. I look at the implants as I'm putting them in while I'm doing the surgery, so we can get it precisely perfect for you. So what the benefits of the anterior approach is low dislocation rate. You don't have to have that pillow between your legs. There's no restrictions afterwards. You can tie your shoes. People go home the next day, and there's a lot less pain. Certainly, you can resume activities. I put this slide in because I don't want you to do this, but you probably could. But certainly, you want to be very cautious. But certainly, driving can come pretty quickly. Certainly, if it's the right side, I don't like you driving for at least 5 weeks. But if it's the left side and you're off of narcotics, I'm okay with you driving at 2 weeks. People who have recovered quickly can go back to work if they're not taking narcotics. And some of my folks who have recovered quickly can recover and get back to work by 2 weeks. I was back in the office at 5 weeks and then operating again at 7. So you can start exercising, you can start stair climbing right away. And again, it's a short stay in the hospital, typically 1 day. There's no precautions, there's no pillow, there's no restrictions. You can drive once you're off narcotics and feeling better. And people want to go home. They feel better immediately. I mean, certainly I always tell patients that it certainly is about 4 to 6 weeks of recovery, but most people are feeling pretty good by 4 weeks. I see patients both at 2 weeks and 8 weeks, both for hips and knees. And for the most part, at 2 weeks, people are having some challenges. But by 8 weeks, people are doing well. And I typically, see you then at a year and say, hey, take it easy. I'll see you in a year. Enjoy your hip. And they come back inevitably in a year saying, oh, my God, this was the greatest thing I've ever done. And so this is a picture of an anterior hip. In fact, it's my hip. So what are the conclusions? Well, certainly prevention of arthritis is always better than the treatment. Well, that's hard because certainly arthritis, being a genetic condition, may have links to injury from the past, weight. But ultimately, once you start developing arthritis, it's really hard to curb those arthritic changes and curb those arthritic changes from continuing to deteriorate in the end. But ultimately, we have a lot of different things that we can trial for you, both from the hip and knee, conservatively, and ultimately, if nothing works, total hip or knee replacement really works very well, and people do very well from these. So joint replacement is becoming more predictable and less invasive. I can pretty definitively tell you that knees take 8 weeks to 3 months to recover from. Hips typically, 4 to 6 weeks, maybe 8 weeks, but certainly they're more predictable. Technology, the new technologies of anterior hip replacement and the smaller incisions and the image guided and the new implants that we're using are part of the answer. But certainly it's each individual patient is going to have a different outcome. So every patient is going to be a little bit different. But certainly as our results continue to improve and we show that people recover nicely and with these minimally invasive approaches, the anxiety decreases. People have talked to others who've had that surgery. Oh, hey, it's challenging in the beginning, but boy, once the recovery time has improved and has gotten faster, I'll be back on my feet at some point in time. So, anxiety decreases, people feel more comfortable moving forward with total joint replacement. And in fact, it's really hard to live with chronic pain from hip and knee arthritis. And so ultimately, these are really great options in the end. So thank you very much, my kids. And I am going to stop sharing. And Allison, are we going to answer questions at the end? Do I answer questions now? Let my colleagues continue on?
Yeah, we'll do that at the end, if that's okay with you.
Absolutely. Okay. Great. I look forward to hearing these next lectures. Thank you for the time, everybody.
Thank you, Dr. VAKIL. I appreciate it. And next we will have Melissa Smith from Age Well Physical Therapy.
Hi, good afternoon, everyone. My name is Melissa. I'm a physical therapist with Age Well Physical Therapy. I actually own the company. And today we're going to be talking about exercises for the mind and body. And we're going to just do a practical application about it. So we're going to do a little bit of exercise today as well. So Friday the 13th, at least that's the day that I had a flight scheduled to Florida. That's when the stay-at-home order was kind of given to us. So we in Pennsylvania were told to stay at home for our health. And at that point, I knew that I had to talk to my team and really get out the word and educate the vast majority of the clients that we see, as well as the community. Staying at home is important for our health so that we can, not be exposed to COVID. But I thought it was really, really important that we should also educate the community as well, particularly our aging adult population, that sitting at home is not good for your health as well. So what we ended up doing was talking to our current patients, and we called a lot of our former patients just to make sure that they were doing their home exercise programs, because we know that sitting for a while, for prolonged periods of time, developing a sedentary lifestyle is not really good for your health as well. And so now we've been in this for about 6.5 months, and a lot of people are starting to feel the effects of, developing this new sedentary lifestyle for the past 6.5 months, which is half of a year. And so what we're starting to see, or what people are starting to complain about, is more pain, more stiffness. Those who are in need of surgery, they may not have had it. Those who, who have arthritis and they were managing it through exercise, their symptoms are starting to flare up. So today I just want to talk to you guys a little bit about that. What can you do at home to, maintain or just start for the first time an exercise routine that can carry you through this time? One of the things that's really important to understand as well, not just for aging adult populations, but just for everyone, is that typically the way our body burns calories, what we typically do, we typically have something called our total daily energy expenditure. And so that's kind of like how many calories you burn, how much you're doing a day. And so a lot of times that's going to be split up between two things, whether you're burning calories through exercise and you're burning calories through your daily activities of life. And so even if you are exercising at home, or even if you are doing something, you had maybe an hour workout a day, or every other day, or every 3 days a week, that's only 60 minutes times 3, or 60 minutes times 7. But the fact that we haven't been getting out of the house, you're not getting dressed, you're not going to the supermarket, to the grocery store, those things have also negatively impacted our activity. So even if you are someone, you're like, you know what, I've been at home, but I've been working out at home, etc. It's just really, really important just to increase your activity, your daily activity during the day. So I'm going to give you guys a few tips on how to increase your non-exercise activity throughout the day that will also help with your circulation and your movement. So the remote control. If you're someone who watches TV still, because a lot of people don't even watch TV, a lot of people watch their shows on their tablets or devices, but if you're someone who watches TV and you still use a remote control, and if you're able to, I would suggest not using the remote control. If you can figure out how to use your TV, because again, those things tend to be a little complicated, but if you can figure out how to use your TV without the remote control, walking to get to the TV, push the button and sit back is another way that you can get some just non-exercise activity into your life. If you're someone who you're staying at home, but you're not getting dressed daily is a really good non-exercise activity to improve your range of motion. It just kind of keeps you limber. So a lot of times what I'll find is that people who stay at home, whether they're homebound or now everyone's kind of home, they tend to put on like either a nightgown or, you know, something very easy. And then once it's time for them to get dressed and actually put on a shirt, that's when they realize, oh my gosh, like, you know, I really have a hard time with my shoulder. Or if you're a woman who has to put on a bra, you're realizing like, oh, I can't bring my arms behind me. So it's really, really important that during this time that you just get dressed daily, even putting on socks and shoes and just giving yourself that, you know, the practice of tying your shoes and things of that nature. It helps with your fine motor control. So those things, typically OT works on, those are your activities of daily living. Because of the stay-at-home order, if people aren't going out, they're not getting dressed, you know, they're losing that practice with their fine motor control, with their shoes or different types of shirts, whether it's a button. So a lot of times if we have loungewear, a lot of our loungewear doesn't come with buttons. So even just, you know, saying, you know what, today I'm going to put on a shirt with buttons just so I can work on my fine motor control is a non-exercise activity that can help with your functioning while you're home during the stay-at-home order. So getting dressed every day is a wonderful way to help do that. Cooking, if you're able, excuse me, if you're able to cook, making sure that you're cooking your meals, that's also a very good way to maintain your activity. So these are just non-exercise ways just to increase your activity while you're at home. Possibly a project at home, if there's a room that you want to work on, any kind of project in the home, again, those are good ways to get extra activity so that you can increase your functioning at home. So that's one of the things that you want to do. So just improving your non-exercise activity is going to be helpful to all of us, just so that we can maintain our function while we're at home. Now, moving on to your exercise activity. So it's very, very important. It's extremely important that we're exercising. Exercise has a lot of positive health benefits. When you're exercising, studies have shown that it increases your endorphin response, which helps with our mood. Exercise, they've done studies on people with depression, and those who exercise had less symptoms of their depression. So exercise is very, very helpful, not just for your physical body, but also for your mental health as well. So it's really important that you do that as well. So there's different types of exercise, and a lot of times people who aren't exercising, they say, you know, what's the best exercise for me? And so a lot of times what we'll say is, you know, something that you really enjoy. So you don't want to go, you know, hiking if you don't like hiking. You don't want to go running if you hate running. You don't want to say, I'm going to swim because that's the best thing and you hate the water and you can't swim. You can find an exercise that works for you. And if you ever have questions about that, that's something you can always touch base with, you know, us at Age Well Physical Therapy or your physician about that. But you just really want to do what works for you and what you're comfortable doing and what's safe for you as well. There's many, many ways to engage in exercise in regards to your cardiovascular system. So you can do a little bit of cardio in the home. And so if you're saying, well, how would I do cardio if I don't have an elliptical or treadmill at home? Well, dancing is cardiovascular activity. Boxing, whether you're punching in the air, that's cardiovascular activity. So really anything that increases your heart rate is taxing or working your cardiovascular system. So you are able to do cardiovascular exercise in the home. Even if your balance is poor, you can do it in sitting. So that's something that you can do that's safe, it's effective, but it also keeps your body healthy. Flexibility, stretching is a very good exercise. It keeps your posture upright. So a lot of times what we'll do with all of our clients, we'll teach them various stretching exercises to do. And the reason being is because naturally as our body ages, what tends to happen is your pectoralis major muscles tend to get tight, which causes your shoulders to round. And then what would also happen is there's muscles in your hamstring that tend to get tight, which causes people to kind of crunch a little bit, and then your head begins to come forward. So practicing stretching daily is something that's going to help you maintain your posture. Posture is really, really important when it comes to balance. A lot of our seniors, a lot of our aging adults are very, very concerned about falling. Well, if you're concerned about falling, you should be concerned about your balance. An analogy I tend to use with my clients is I'll say, well, would you put your fine china on a table that's leaning? And they'll go, oh, no, I would never do that. And I said, well, why? Because it'll fall. And I said, well, you're leaning. So we got to work on that. We got to work on your posture. We got to get you upright. So stretching, particularly to increase your posture, your upright posture, is extremely important to do, not only during COVID, but all the time. Okay. All right. Strengthening, making sure that you're doing functional strengthening that challenges you is extremely important to maintain your body during COVID. So a lot of times what will happen is, and we work with aging adult populations in all phases of their lives, from their, late 50s to 90s, and we even have a client who's over 100 years old. But one of the things that we'll find that makes it difficult for someone to be independent is if they lose their functional strength, particularly their ability to stand. Once someone loses their ability to stand by themselves, unless there's someone who's trained to move around in a wheelchair, they then may need help. And if they're unable to get help 24 hours a day to get up and go to the restroom, to get up, to go to bed, etc., then they may be someone who needs to go into an assisted living or nursing home. So one of the things, of course, with Age Well Physical Therapy is that we're trying to teach our clients how to age well in place, to age well in the home. So we want to limit that. So strengthening functionally is extremely important. So even doing an exercise such as standing up and sitting down is very, very important to maintaining your function and independence. Of course, if we're at a stay-at-home order and you're someone who, doesn't get out of bed, or you don't get up quite often because you're just kind of hanging around, your ability to stand up and or sit down may be limited due to, weakness, due to atrophy, just by not moving, as well as the other conditions such as arthritis that the surgeons talked about that could also be causing your inability to stand up. So maintaining good functional strength is extremely, extremely important just to keep your independence. So doing a simple exercise such as standing up and sitting down daily, that can help maintain your functional strength. And if it's easy, great. And if it's difficult, keep working on it, but constantly do it, no more than 10 times a day, but it's a good exercise to add into your daily routine. Okay, so we talked about strength, we talked about flexibility, we talked about your posture, we talked about cardio. So the last thing we're going to talk about in regards to practical exercises for your to maintain function in the home is balance. Balance is something that can be devastating, because if someone has a fall, that could lead to the need for not elective surgery, but an emergency-based surgery due to a fracture. So if you break a hip, you may need to undergo surgery, and if your heart and things of that nature aren't prepared for that, and due to the immobility that's associated with the illness, it can be devastating on your independence and your function. So one of the things that I try to tell people is, listen, accidents happen, people fall. I fell last week. It happens. But one of the things that you can do is you can prevent falls by increasing your response time to falls, whether you catch yourself or not. And also, fall prevention also has a lot to do with some of the things that you're doing in your home, or how your home is set up. If there's a lot of clutter, if there's a lot of clutter, or throw rugs, or pets that are not controlled and they're kind of running under your feet, and if you don't have the reaction time to catch yourself, then that could lead to a fall. So although accidents happen, the risk of falls can be significantly reduced by changing your environment and also by strengthening your body, as well as working on your reaction time. And there are some balance exercises that can be done. So I am a Tai Chi instructor, and Tai Chi has been clinically proven to improve balance. So doing safe exercises such as Tai Chi, as well as just some other exercises that improves your balance, can help change your body to increase your reaction time and improve your balance, which is going to be really, really important, because the last thing that we want to do during a pandemic is show up at an ER because we fractured something. And then, of course, we're trying to stay at home, and now we're in a hospital where a lot of these, these illnesses may be prevalent. So maintaining good strength, flexibility, posture, cardio, vascular exercise, all of these things are good for the body. But one of the things that's really important is a lot of times we do not feel like exercising. So a lot of times if we don't feel like doing something, we're just not going to do it. And so a lot of times what I'll do with my sessions, depending on the person and depending what they're going through, we'll do a little bit of Tai Chi or Qigong so that we can work on just deep breathing, just trying to relax, doing some things that can help minimize some of that anxiety. So that's what we're going to do a little bit of today, because it's a safe thing to do, since I'm not sure who's watching and I don't want to give you guys balance exercises that everyone's falling and I can't catch you through the internet. So today we're going to do some Tai Chi, and we're going to do some things that's going to help us relax a bit. One of the things that's really, really important to healing, there was actually a study that showed that people who had less stress had improved healing in wounds. So some of the articles, they did some punch wounds, or some of them, it was wounds from surgery. But whenever you have a lot of stress in your life, any condition that you have with that, when you have the stress, it would make the healing aspect of that condition worse. It's not to say that you won't heal, but people who are in a better mood, people who have less stress, tend to have better outcomes than those who are stressed. Also, there are hormones that are produced when people are under a lot of stress, which tend to also slow down the healing process. So not only does doing things such as Tai Chi make us feel good, it actually helps our body respond better, and also it just kind of helps to promote the healing process as well. All right, so I think I'm gonna kind of get started on that, okay? All right, so what I'm gonna do, if anything that I do is difficult or painful, one of the things that I always tell all my clients is that you're not in competition with anyone else, you're only in competition with yourself. So your goal is just to do a little bit better than your yesterday. So if I do something that's uncomfortable and you're unable to do it, I would ask that you don't do it. So what you can do is use a little bit of imagery, just kind of imagine that you're doing it. But I don't want anyone to, lift their shoulder if it's painful, or do anything that's painful. But today, most of our exercises don't have a lot of shoulder range of motion. It's just really deep breathing. And so I believe that you guys should feel comfortable with that. Okay, so I'm gonna move back a little bit, and I hope everyone follows along with me. Okay. So I'm gonna do a little bit of Tai Chi, and I'm mixing in a little bit of Qigong, okay? Hope everyone can see me. All right, so what we're doing, okay? So we're gonna do the 5 elements, okay? So the 5 elements are gonna be of earth, metal, water, wood, and fire. And so these 5 elements represent the things that help us with life, okay? But really, one of the things that I want people to understand is that it's just giving you an opportunity just to breathe and just to be calm and just to focus on what you're doing at that moment and just be mindful. So if the 5 elements, if that seems like something weird to you, the way that I teach my clients is use what works for you, what imagery works for you, and you can personalize it for yourself, okay? All right, so what you're gonna do, you're gonna sit, relax, shoulders nice and relaxed, okay? And then what you're gonna do, you're gonna bring your arms slowly up. And look at my hands, they're kind of dangling. So they're nice and relaxed, and then you're gonna bring them down. Now this is the beginning of Tai Chi. I'm doing a little bit of a fusion. So please follow along with me, everyone. I can't see, but I'm hoping everyone's following along. So we're gonna do this 2 more times. Now, one of the reasons why the movement is so slow is because it's supposed to promote mindfulness. So a lot of times as we move around, particularly in American society, we're always in a rush. We're always moving, we're always getting around. We rarely slow down. So these movements are slow so you can feel what your fingers are doing as they dangle upward and then as you bring them down. Good. Now you're gonna bring your hands up in front of your chest and you're gonna take a nice deep breath in. And out. We're gonna do that 2 more times. Deep breath in. And out. As you blow out, it's important to blow out as if you're blowing out a candle. Deep breath in. And out. Now we're gonna go a little bit into the Qigong. So what I want you to do with your hands, I want you to place them in front of your abdomen. Okay, just place them in front of your abdomen. And what you're gonna do is you're gonna take a nice, gentle breath in and out 3 times. Now this position represents Earth. And what I like to imagine when I'm representing Earth, I like to imagine I'm walking in like a nice, dark, rich soil and it's warm under my feet. The next position represents water. So, the next position, represents metal. And the metal represents the minerals that are in the earth, okay, that help things grow. So you go into the metal, come here, and you're almost breathing in and out, but it's a little bit quicker. So right now, I'm just imagining the rich minerals in the earth that help things grow. And then I go back down to earth. As I think about that warm soil, like when I was a kid and I used to run around in the backyard, I just think about that. 3 breaths. Now the next position is the water. Now the water condenses in the soil. So we're thinking about the water just dropping. So at this point, what I want you to do is almost relax. And then come back up. And then relax, almost just relax. And come back up. As you relax, you can exhale. And come back up. And then now we go back to earth. 3 breaths. The next thing is wood. So wood represents the trees. So of course you have the earth, the minerals, then you water the soil, and then the tree grows. So nice deep breath in. And you bring your arms up almost like you're making a circle. And then breathe out. So at this point, I always kind of feel like I'm making a circle around a log, but this represents the wood. And then back to earth. 3 deep breaths. Now the next position that we're going to do, the next element represents fire. So if you think as a kid, you know, we used to rub the wood and try to get fire. So all the elements fall in line. So what you're going to do, you're going to bring your hand up, okay? So you're going to take this hand, okay, that's your left, my right, and you're going to bring it up. And then you take this hand, that's my left, possibly your right, okay? And if you were to close your hands, they're touching. What you're doing is almost like an accordion, you're bringing it up, breathing it up, and then out. As you bring it out, the hands close up and out. So every time you go up, you're breathing in, and every time you go down, you're breathing out. And then go back to earth. And so if you think about the ashes from the fire that goes back into the earth, and then that cycle starts again where you have the earth and the minerals and the water which grows the plants that feed us, and then the wood to the fire. Okay, so we're gonna do something else. This is a little bit back to Tai Chi. Deep breath in. Now the next activity I like to do when I'm stressed. So what we do, what I want you to do is imagine that something that is stressful to you, imagine that item is in your hand right now, like whatever it is, whether it's the, you know, this whole COVID thing, the vaccine, whatever is going on right now. I want you to imagine that that item is in your hand. And the reason why I like to do this activity with people is because I always say, you know, we all have stress, whatever it is, whether it's pain, whether it's family situations, whatever the case may be, we always have something that's stressing us. But what counts or what matters is what we're actually doing with that stress. Are we going to take that stress and, you know, make it hurt us? Or we're going to take, I always tell my kids, you know, turn your pain into power. We can't control what comes our way, but we can control how we respond to it. So what I want you to do is I want to imagine whatever it is that might be bothering you, I want you to kind of tense your fingers up, almost like a stress ball, like you're like, ah. But I want you to tense your fingers up, and then I want you to relax. And I want you to tense your fingers up for about 3 seconds. And I want you to relax. And then I want you to tense your fingers up. And then I want you to relax. Now what I want you to do is imagine that you're taking that issue. You're not neglecting it, pretending it doesn't exist. But what you're doing is for this moment, you're putting it away, okay? When you put it away, I want you to really relax those hands. And for me, it feels so relieving because a lot of times what I say is, you know, I don't want to worry and stress about the things all day long. I'll deal with my issues and then I put it away. I can't let that issue take over the 24 hours of life that I was given. It can get maybe 20, you know, maybe 1 hour of my day, but not all day. And then we're going to do it again. So you're going to tense those fingers up and relax. You're going to tense those fingers up and relax. And then you're going to tense those fingers up again and relax. And then we're putting it away. Now, the second time, what I like to do when I'm imagining I'm putting that stress away, I try to imagine my support system. So a lot of times we do have problems. So you're going to kind of relax a bit. A lot of times we do have problems with things that concern us. And a lot of times I say to myself, you know what? You need help. And so that second time around, I've dealt with the fact that, all right, I have the stress, I'm putting it away, but now it's still lingering. Now, what am I going to do, or who can I reach out to that can help me, whether it's and again. And a gentle twist, and a so hopefully everyone feels nice and relaxed. And a lot of times I tend to do these exercises with my clients either before our sessions or towards the end of our sessions, or sometimes I'll do it before and after. A lot of my clients, they do have anxiety, they are stressed out, sometimes they're not in a mood or whatever the issue is, so I'll try to do that to get them, you know, kind of prepared to exercise, just nice deep breaths, get the oxygen flowing, and then we get into our exercises, and sometimes we'll just do it after. It's kind of like our happy ending. But one of the things I just wanted to reiterate, of course, is that during COVID, some practical applications, just to recap. So during the stay-at-home order, we're not getting our non-exercise activity, which we don't realize, you know, hitting the gym is only an hour of our day, but we typically are moving around a lot more than 1 hour. So because of COVID, a lot of us aren't moving around like we used to. So it's really, really important that if you are someone and you're seriously staying at home, just moving around, walking around in the house, you know, it doesn't have to be like, oh, okay, it's 5 a.m. and I'm going to walk 10 miles in the house. You can just incorporate those things naturally into your routine. You know, instead of asking someone to get something upstairs for you, get it yourself, not using the remote control, those type of things. So just making sure, you know, that we do these things as well. Thank you guys so much for your time.
Thank you. Thank you so much, Melissa. I appreciate it. And last but not least, we have the fabulous NATASHA GOLDSTEIN-LEVITAS, who's going to be doing Let's Get Moving, sensible engagement anytime, anywhere. So NATASHA.
Thank you so much for that lovely introduction, Allison. Can everyone see my screen okay?
Yes.
You can see my slides? Let's see.
Oh, no, yeah, share your slides.
Yeah, okay. Okay, well, I just, you know, again, thank you, Allison, and many thanks to New Courtland Center on the Hill and Chestnut Hill Hospital for hosting this wonderful event today. It is a pleasure to share this virtual space with you. It's not like being in person, but here we are, and we're going to keep moving. And we've been hearing that message a lot today. So we're going to talk about some more ways to keep moving in a sensible way and to stay engaged anytime, anywhere. So just like to start with this slide. So this is Martha Graham. She was a pioneer of one of the modern dance forms. And
Natasha, sorry, we can't see it. Did you share your screen?
I sure did.
Okay, hold on.
Let's see.
Just want to.
Yeah. Let me see. You know what? Let's try this again. Share.
There we go.
You see?
Yep.
Okay,
perfect.
Technology, right? Like I said, nothing like being in person. Okay, so Martha Graham said, the body never lies, and so true, because every posture, every gesture is communicating something, right? when we have a lot on our minds, we have a heavy heart, we feel that in our body, right? Especially with the losses and traumas in our world today. Did you know that the mind and body are connected? And Melissa certainly touched upon that concept with beautiful Tai Chi and breathing exercises. And we'll be talking about breathing as well in a few moments. And memories and emotions are stored in the body, right? We're rich, living, breathing histories. And movement is constant through the life cycle. We're born moving and breathing, right? All the way through life. So we're going to keep moving. Why? Why keep moving? Because it yields biochemical changes in the brain. It activates and strengthens neural connections. It releases those feel-good hormones, right? Oxytocin and serotonin. Increases that mind-body wellness and helps to further that mind-body connection, which is so very vital for feeling grounded and for being able to take one step in front of the other and keep moving forward. Enhances our physical and emotional health. Do we need more reasons than that? And of course, there are many more reasons to keep moving. And did you know that even facial movements, deep breaths, filling up our lungs with oxygenated air, right? And breathing out, and laughter, which involves movement, counts. Doesn't just have to be full body movement going on, but it can be. So it's wherever you are, meeting yourselves, meeting your loved ones, your clients, right where they are, and joining them in a very real and human way, right? Through gesture, eye contact, making some facial expressions together to validate how we're feeling, right? Whatever that is, whatever those feelings are. Breathing deeply, and thank you so much for Melissa for taking that time and space to help us to breathe. Right? We don't always take that time to breathe deeply, but can really help to release that held emotion and tension, help to balance our nervous systems, which we need now more than ever, can lower those stress hormones, can calm and slow our heart rate just by taking those few simple deep breaths. Calms and focuses our mind. We're trying to remember something and we're stressed, let's just take a deep breath, right? Take a step back and then try to remember, right? Take that time in that space. It's so vital for that self-care for all of us. And it can help to change our perception in that way, right? We're coming back into this task we need to complete, right? Or that care we're needing to provide. Right, in a very, in a calmer, very grounded sort of way. Okay. We want to set the scene for ourselves, for our clients, for our loved ones. And what I mean by that is by, decluttering our environment, right? Putting on some music in the background that's near and dear to us, that's nostalgic to the individuals in our care, perhaps, right? Maybe putting some flowers, real or silk, on the table next to us, really creating that right environment so we can feel like we want to keep moving. And it doesn't have to take a lot, but just taking some time and some care to set that scene. We want to prime for that best possible outcome, okay? And we want to, in doing so, in setting that scene, we want to help our clients and our loved ones and ourselves to feel more at home. And we know home is not always safe for everyone. We know it's not always a safe place. And some of us are spending more time at home these days. So home can just have many different connotations, but what I really mean is that we want to help create that warm, welcoming, and comfortable atmosphere, right, for our clients, our loved ones, and again, for ourselves, to help us to feel motivated and inspired to want to move and to want to engage, right? I feel like that's a really, really important component to introducing anything, any type of engagement, really, again, setting up that scene and that space to make it most comfortable, and that shows us that we've cared about our environment, or we care about that environment that our client or loved one is coming into. Very important. So even if we feel like pulling our hair out, which many of us do these days, right, more than ever, I'm gonna try to simplify. Try to simplify, even if it's just for a moment, taking a step back and being mindful about how we move in to that space to complete our exercises or our Tai Chi, right? Or engage in our breathing, or perhaps if we're a nurse, handing out a medication, right? Or providing that care, whatever it is, to our clients and loved ones. Simplifying, decluttering that space, setting up that scene, one thing at a time, right? If we're going to use stretch bands for exercising, or scarves to hold on to, maybe not giving ourselves too many, or our clients too many to choose from. Just a few, you know, simplify. It feels a lot lighter this way, a little easier to manage. Once we simplify, we can then find a way. We can dig deep, even when some days it feels impossible. We can find a way to keep moving and keep putting one foot in front of the other. And we're going to improvise. I mean, we do this in life, especially now, right? Especially now. So we want to take what we have, what is accessible to us, and just work with that and just go with that. Kind of play with that, have a dance with that, right? How can we set up that environment that we have? What items can we use? And I'll get into more of that in a moment, what items we can use to help engage and move a bit. But just going with, right? Oftentimes we come in with a plan and it goes right out the window. So just going with the flow. And try to remember, or keep telling yourselves, you are in control. And I know it doesn't feel like that, especially lately, right? All the weight of the traumas and losses going on right now for us personally and in the world around us globally, right? With people we care about or caring for. Remember, you are resilient and you are in control to help set that scene and prime for it the best possible outcome. And it takes practice. So there are lots of ways that we can engage, right? Ourselves, our clients, our loved ones. Music is a great motivator, and I'll talk more about that in a moment. And using imagination. Melissa was sharing some lovely imagery with us, and we can, tap into our imagination whenever we need to. So setting that scene can maybe be creating an environment in our imagination. Are we on a beach? Can we put on some sounds of waves in the background? Can we maybe imagine that we're moving with the waves? And you could do this with me if you like. right? Imagine what that looks like and what that feels like, which brings me to my next point, sensory engagement. Sensory engagement, because we experience the world through our senses, all of our senses. And when we're stressed, sometimes we need a little more help accessing those senses. And also, as individuals have experienced trauma or perhaps are dealing with memory loss, we need to play perhaps a more active role in helping to bring those sensory engagement techniques into that exchange. I hope that makes sense. The sound of music. So why music is important, and it is. It helps to inspire movement. It helps to ground us. It helps to organize. It engages our auditory cortex and our limbic system, and it actually accesses the movement centers of the brain. And not just any music, but music that is near and dear to us or to our clients or loved ones. Because if it's not familiar and it doesn't resonate, it might produce an unwanted effect. Yeah, it might be upsetting, right? Or cause us to feel more stressed if it's not music that we were used to hearing growing up, right? Or music that we enjoy or that's culturally sensitive, okay? So music also can elevate our mood. It can elevate our mood. When we hear that music that we enjoy, our toes start tapping, our shoulders may start moving, right? It just, that rhythm gets in there, yeah? I know I have a few more moments. I'll keep going quickly. So engaging our senses, you know, even if just, I have a stress heart here, but imagine that this is an apple, right? It's that time of year, right, for apples. So we can just squeeze it in our hand, and roll it on our arm and notice the texture of it and the smell of it, right? Engaging our senses, because that can also help us to feel motivated, and it's also a very mindful approach, okay? So when we're peeling that orange, really peel that orange, And I think, you know, in order to move towards this self-care plan for ourselves, right, we should really just think about maybe how you might want to set that scene. What does that look like? And it might be different today than tomorrow or next week. What ways can we engage our senses? What ways can we help our clients to engage their senses, right? Is it by arranging some fresh flowers on the table, just to kind of change the energy for a moment? A pleasant distraction, but a meaningful distraction. And move, right? We want to keep moving, even if it's making facial expressions or Tai Chi or fuller body movement, right? Moving our shoulders, going with whatever is right for us in the moment and right for our clients and loved ones. We don't want to force, we want to go with. That is the dance, that is the exchange. Practicing healthy self-affirmations such as saying, I am strong. I am doing the best that I can. Sometimes we need to say this to ourselves, right? And that's okay. And honoring that we are resilient. And of course, laughing whenever we can. We need to laugh. We need to laugh and have fun. Have fun with the process, whatever this is. And so I know I'm running out of time, so I'm going to stop there. If anyone has any questions at all, feel free to email me or contact me through my website. Again, thank you so much to all. It was a pleasure somewhat moving with you in this virtual space today. Thank you so much.
Thank you, Natasha. That was wonderful. And again, thanks to all the speakers here. I know we're doing well on time, so that's perfect. Does anybody in the audience have any questions for any of the speakers here, or anything they'd like to ask?
Yes, so I actually had a question. I mean, I won't share the name, but somebody texted me or group chatted me an email. I think I said, I have a crunchy knee, told I have arthritis in the corners of my knee, but cartilage is crunchy. What should I do for this? No continuous pain, but sporadically according to activity. Thank you, the person who's asking the question. So, again, just to kind of answer that question, certainly, an evaluation by me would be valuable. And again, getting x-rays and doing a formal examination, I think what I would recommend for this person here. So, it's a little challenging to be a quarterback over the Zoom meeting here to tell her what to do. So if there's any chance you want to make an appointment to see me, I'd be happy to see you and really try and help you manage your arthritis. Oh, and by the way, ladies, from everybody, you guys did a great job. I love the talks and the calming. I'm going to try and calm myself down with some deep breathing, hygiene stuff. So thank you guys. That was great. I didn't see any other questions, so that's my answer for our question.
Anybody else?
Hold on, I lost my screen. Hi, this is Jean Kirkley, and thank you, Doctor, for that response. In relation to the caregivers, I have Boomers Are Heroes caregiver support group, and the caregivers are under a lot of stress. I have more of a comment than a question, because the exercise, the deep breathing, the personal movement, and the visualization is something that's very important to my folks. And I want to reach out to each of you to possibly speak with my folks, with my caregivers at some point or another. And my question will be, if I send you out an invitation, would you get back to me to let me know of your availability? Because my caregivers need all the help they can get. We're doing Zoom meetings. They're not getting that personal, in touch, rah-rah, tactile thing that we normally do. But being able to talk to each other is helpful, and coming with some new information or new contacts is always helpful. So I'd appreciate you working with me at some point. Thank you.
Thank you, Jean.
Mm-hmm. No problem. So Allison, I'll just need you to put me in touch with them, and then, okay?
Absolutely. I will.
Thank you.
Anybody else? Well, if not, you can, like I said, you can all email me. My information's on the flyer. I'm happy to provide information for Natasha and Melissa and Dr. VAKIL. And then again, Mary Angela will be putting that on Center on the Hill's website. We'll be putting it on New Courtland's website. Melissa, you'll be putting it on yours, right? And we'll get it up there for all the seniors, because again, this was a large topic for them that wanted to, now we're all at home right now. So what are those practical applications that we can use to move in place, especially since many of our seniors are in our buildings, and they really are looking for things to do. So I think this was a really great webinar. Again, thank you, Dr. VAKIL and Chestnut Hill Premier Orthopedics, and Natasha. I'll be seeing you soon, and Melissa at Age Well. So I just like to thank everybody and hope you guys have a great day.
Oh, and Allison, we're doing free classes once a week online via Zoom and through our Facebook page. So if people are interested, I haven't uploaded the class schedule for October, but we're doing free classes. So if anyone wants to continue or forgot anything, once a week we have a free class online. So you just sign up through our website.
Perfect. Awesome. All right. Well, thank you. Thank you, Mary Angela.
Thank you so much.
All right. I'll see you guys.
Thank you so much, everyone,
Bye.
for being with us. Thank you.
Thanks, everybody. Bye-bye.
Thank you all. Bye-bye.